Welcome to the Women Growing Older presentation, a national Photovoice project on the experiences of cannabis and aging for women. We'd like to acknowledge that McMaster University meets and learns on the traditional territories of the Mississauga and Haudenosaunee nations and within the lands protected by the Dish with One Spoon Wampum. The women that engaged in this project were across the country, and we did research on the traditional and unceded lands of Indigenous people throughout Turtle Island. We'd like to thank the 13 women who participated in the Women Growing Older project and the Michael G. DeGroote Center for Medicinal Cannabis Research for funding this study. We also want to acknowledge that women have been using cannabis for centuries, and we learned about women from many, many years gone by who've used cannabis, taken the control in their own hands to take care of themselves. The Women Growing Older project is grounded in a feminist approach to arts-based research, and we did a pilot study that brought together a diverse group of older women from across Canada. We wanted to learn about their experiences of cannabis use, access to medicinal and recreational cannabis, and access to cannabis-related information and support. Women from across Canada came from New Brunswick, British Columbia, Ontario, Alberta, and Saskatchewan. Most women were in their late 60s to early 70s, except for one woman who was 52. They accessed cannabis through medicinal purposes, through legal dispensaries, through their own growing, and other ways. They use cannabis to support them through physical health concerns such as osteoarthritis and arthritis, and mental health concerns such as anxiety.
We used a virtual approach to Photovoice, and it was an arts-based method that brought together women to collect and analyze data that was grounded in their own lived experiences. The process required that participants take photos to respond to a set of research questions. Over 10 weeks, we met together for the purposes of sharing the photographs with both the researchers and the participants and engaging in dialogue about individual and collective experiences. All Photovoice sessions were recorded and transcribed. Our approach to a virtual Photovoice methodology involved several unique steps. The first was around technology training and access. We were committed that barriers to accessing technology would not prevent women from participating in our study. So we made tablets available and trained women on how to participate in Zoom and share their photos. Over 10 weeks, women participated in engaging in art, reflection, and collective dialogue. Over those 10 weeks, we embedded 2 cannabis education sessions, one by someone working in the cannabis industry and one by a physician who prescribes cannabis. This was an opportunity for women to ask questions and learn more about cannabis in the context of legalization and in the context of medicinal use. We also engaged in participatory analysis, which meant that the women who participated in the study were deeply involved in doing narrative and visual data analysis with us. We did this through individual interviews, through a group process, and through a virtual symposium that allowed both groups of women to come together and review and refine the findings.
4 main themes emerged from the visual and narrative data in the study. So one was the high degree that the participants rely on their own experiences, research-seeking activities, and knowledge sharing. The second was the importance of accessing peer networks and social media channels for information and support. The third was the importance of having access to cannabis and control over the mode of consumption. And the fourth was impact of cannabis on the participants' capacity to enjoy their life as they age. Of equal importance was the ways that engaging in a virtual arts-based research project resulted in the positive outcomes in the lives of the participants, particularly those who otherwise would have faced barriers to participating in health research. So one of the themes, which was experiential knowledge and self-research, focused on personal experience, sharing and hearing stories about the benefits of cannabis, self-research, piecing together information about the benefits and risks of cannabis, and wanting more information, sort of a central source of knowledge and information. This picture here from one of the participants juxtaposes the interactions with the cannabis bud as well as prescription medication. She talks about no concerns taking the CBD, no concerns taking the cannabis. It's all about putting natural products into my body and not using the chemicals. I think over time, you don't really know what the chemicals are doing to your body, over time. I really, really would like to have a more natural, and I would want the doctors to start looking into that too. This other picture really focuses on the seeking out of information through sources and other resources, particularly focused to cannabis. This book was sought out and purchased by one of the participants as she was just looking to sources to learn more about cannabis. So she says, looking for stuff, it's either reading my book, reading books, talking to people, or actually going on the website. I actually liked this book because it talks about lots of things like having, like making stuff with the cannabis, like soaps and taking a bath, sex and cannabis, all the different things are there. This picture really hones in on the pursuit of knowledge. This participant says, the more you learn, it's like a snowball effect. You start off small and then you just expand your amount of knowledge. And then the more you learn, the more you find out there is to learn. I guess it's just the search for knowledge. And you have to move past the stigma that there is with marijuana. You have to move past the biases that some people have, and you've got to find out what works for you.
Throughout this study, we also heard about the importance of peer support networks and social media as a source of information and support relating to cannabis. Participants shared that the methodology itself, the ability to meet and connect weekly with other women from across the country who were also consuming cannabis as they aged, was incredibly beneficial for them. This is a picture of a women-specific group that exists on Facebook to answer questions and provide support around cannabis. And it came up quite frequently in both workshops. This woman says, I know the information there is good. I know whatever they're putting in there, it's been looked at and checked out thoroughly, and you can rely on what's there. And there's always someone to chat with. You could ask questions, you could meet 2 or 3 other people and have a chat with them about how they're using it and what they're doing. During our virtual symposium, we asked women what it meant to participate in this study, and we asked women to share a photograph. And one woman used this image to describe that in the absence of a peer support network that existed that was specifically for women growing older in cannabis, the workshop group itself, the connection she made with the other women had done that for her. She talked about staying in touch with the participants and the bond they had shared and the ways they continue to support each other, provide information to one another, and share resources relating to cannabis.
This theme talks about gaining a sense of control and the women finding ways to access and consume cannabis that best aligns with them. So throughout the project, we heard about the barriers to accessing cannabis and CBD products despite legalization. And this was largely due to the differences in provincial legislation, financial barriers, and accessing preferred modes of consumption. This picture is from a participant who was out in British Columbia and talked about the barriers to accessing cannabis in the ways in which that are meaningful and most useful for her physical health and mental well-being, and having to sort of take control and take matters into her own hands over her own health. So she says, this is the way women my age want to use cannabis. If I'm sore, I can just kind of pat it around my knee and the pain will be gone within 10 minutes. This next image really doubles down on the first image, really looking at the multiple ways in which women, as they grow older, look to consuming cannabis for their physical ailments, their physical health needs, and their mental health needs and well-being. This participant says, I see wonderful homemade medicines that will not give me reactions or have any negative side effects. Just having the quality control over what I am using is paramount to me. And these things are all things that bring me more relief than I ever found with pharmaceuticals. I see that this is what women my age are interested in.
A key finding throughout our study was the idea that cannabis and CBD was leading to an improved quality of life for women. We heard about the ways it was enhancing both their mental and physical well-being. We heard about the ways their pain was decreasing and their overall sense of well-being was increasing. Participants shared about the multiple ways they were able to enjoy their lives more as they aged, and they connected this to their consumption of cannabis and CBD products. The idea and the concept of grandmothering came up in multiple different ways. And this woman talks about the relationship and the caregiving that she's been able to do for her grandchildren since she started consuming CBD. And she says, I, I'm I'm going to want to sit on the floor and play games and stuff. And it's like, okay, I've got to get myself a little bit better. Other than taking opioids, other than taking pain pills, other than going for surgery and having parts replaced, I've got to do something so that I am better for them. This woman uses this image of a chair to talk about the ways in which her quality of life has improved significantly. And she says, I finally got rid of that old chair that I had sat in for 5 years. I sat in that chair and read and ate cookies pretty well. And that's when I was feeling so sick. And as I get better, I use it less and less. This woman uses an image of herself on vacation to talk about the ways that, CBD oil has sort of shifted the way she's able to enjoy her life. And she says, I have the freedom to walk in a way that I haven't been able to. It's strengthening my muscles and my view on life, really, because I was feeling down. I see a future. It allowed me to go on a holiday that I hadn't had in I don't know how many years. The CBD oil gave me hope. This woman talks about her bucket list as she ages and talks about making jewelry as something that's been an important part of her bucket list. But she also shares, my hands were really the first part of me that became quite affected by osteoarthritis. My entire adult life has become a case of progressively trying to raise my pain threshold to do the things I have wanted to do most days. My bucket list keeps growing. There's such an enormous, wonderful world out there, and there are so many people I have not met yet. Being physically comfortable enables your mind to do other stuff than just try to figure out how to get around the discomfort. And this photo is a photo of a woman on a motorcycle ride. And she talks about the ways that being able to be active has improved her quality of life in so many different ways. She says, without cannabis, I would not be able to even ride at all. I would maybe for like 10 minutes, and I can do 4 hours at the most now. So that makes such a difference in my physical, emotional, spiritual, every way to be able to do that.
Emerging from the photos and the women's narratives were important thoughts for us to be thinking in terms of future research and program development. And these include, building on our findings currently relating to women growing older in cannabis and therefore applying for additional research funds to continue our work. Explore further opportunities to engage in virtual arts-based research with women who are aging, acknowledging that they face barriers to participating in in-person health research, and to develop peer support and peer education programs relating to cannabis information and cannabis support for women growing older. In the words of one of the women in our study, who depicted this beautiful photo that describes the foundation of cannabis in her life. The foundation will be the prescription and the cannabis being supplied. The second rock is another, my out services of where I would go for different supports like supplies, to get beeswax, the essential oils, different stores I would have to go to get my salve, and then other iron rock in the middle, the flat one, is more like maybe community members who I engage with. Then the top, those two top tiers, are the pharmacy or the grower and the doctor that prescribes. This is the solid foundation of what cannabis could look like if the individual is given the prescription, and then they would be able to balance on a daily basis how that would look to them. Some people's rocks would be maybe different stacks, and each individual, it would be different. For me, it's having the source, the product. Once I have the product, then I'll be able to make all these lovely things that keep me functioning and engaged.